New York Governor Andrew Cuomo remaining defiant over his handling of the coronavirus pandemic in nursing homes, continuing to claim he did nothing wrong. Let's bring in Republican New York State Assemblyman Byrne. He is also a member of the Health Committee. Assemblyman Byrne, thanks for joining us. What more can you tell us about the investigation into this scandal?
Well, this is something we've been pushing for quite a while, just trying to get the basic information that the Department of Health and the governor's administration withheld from lawmakers and the public since June, July of last year. We've had hearings and forums, but a lot of information has been dripping out over the last several weeks that has painted the governor's performance last year in a much different light than what we were living in real time. It did prevent the legislature from getting the full picture of what was happening in our nursing homes, and it limited us from taking any sort of corrective measures. The governor in his recent press briefings has been absolutely just being just out of touch. He talks about a void. I think the void is between what he thinks of himself and what's reality, because he's trying to suggest that lawmakers were told certain things. Legislative leaders have responded back, disputing that, saying that we weren't given a real reason as to why there was a delay. The only answer I received last year for a delay in the information was that there was risk of double counting and accuracy. Then all of a sudden, it comes out from a private partisan meeting that the delay was because the administration was fearful of how the information could be used against them by the U.S. Department of Justice. So there have been additional calls, and I'm pleased to see that there's now been reported investigations from the FBI, as well as the U.S. attorney over in Brooklyn. But we need to do more. The legislature needs to act as well. We have a responsibility to get to the bottom of this, and I'm asking for the state legislature to investigate too.
Meanwhile, what do you make of the way the governor is handling this investigation and criticism?
Oh, that's a great question, because I think what we've seen in the last several weeks is the governor being exposed, not just what, this cover up, but his personality. It's, I think recently he said he needs to be more aggressive with the people that I would call truth tellers that have been trying to expose the truth, which would include legislators, grieving families, good government groups, and to an extent, the press. He's suggested they're the ones spreading misinformation when, in fact, he's the one that's been dishonest and withholding information from the public. So saying that he's going to be aggressive with legislators and members of the press, I think that's alarming, as it should be. And it's indicative as to what we saw recently with how he reportedly attacked on the phone my colleague, Assemblyman Ron Kim.
And meanwhile, the New York State Health Commissioner, Dr. Howard Zucker, says, quote, with the facts that we had at the moment in time, it was the correct decision at that moment in time. Is that enough?
No. You know what? I understand this was a pandemic. It's unprecedented. I think people can honestly say that there's going to be mistakes. But the Department of Health came out with a July report that was a full-on defense of the March 25th directive, which in that report conspicuously left out the data we were seeking, which was those nursing home residents that died, but died in hospitals. It excluded that data. And the health commissioner, in a recent report that came out from the data that we finally got from a court order from the Empire Center did an analysis that showed there is a correlation with that March 25th directive with putting COVID patients into nursing homes and increasing the mortality rate, and that it may not have been the cause for all nursing home deaths, and I don't think that would be accurate to say either, but it certainly made a bad situation worse. And for them to pretend that it didn't, I think, is irresponsible, to say the least.
Really quickly, have you been in touch with any of the families who have lost relatives, at nursing homes entangled in this scandal?
Yes. I mean, I've spoken with Janice Dean. We've had forums. I have friends who lost their parents. And you know what? I do get a little bit passionate about this issue, because when you get so invested in something, it does become a bit personal. Even when you're a lawmaker, it really does start to hit home. And many of these people did lose their loved one in a hospital. And for almost a year, they were being told that, well, that was a hospital death, not a nursing home death. And they knew it was an issue in the nursing homes. And what's crazy is we talk about these things, and you know what? If someone gets hurt or killed in a car accident and they die in the hospital, no one says, oh, it was a hospital death. You died in a car accident. And what the governor's administration is trying to do is saying, well, the total numbers didn't change. That was never the issue. And we were never saying that. We're talking about, did this order increase mortality? Did it spread infection? And what we're also learning is it's very likely that the impact of that order was very negative, even more so for upstate New York, because they were hit a little bit later than New York City. And they did delay the information for months and months and months. And I feel like every day, this story, we keep on learning more information. And every time the governor speaks, it keeps on getting worse and worse for him. So we need to hold people accountable.
Assemblyman Kevin Byrne, thank you for joining us. And of course, we have prayers for those who lost loved ones in the midst of all of this. Thank you for joining us, sir.
Thank you, Arthel.